Hello everyone, this is Dr. Akhila Janaki. I am a veterinary retina consultant at Pushpagiri Eye Foundation. Acanthamoeba Keratitis is basically an infection of your cornea. So what is cornea? Cornea is the clearer outermost part of your eye because it causes severe pain, redness, watering. The symptoms are very severe. That's why this infection should be discussed. I'm talking about acanthamoeba in view of contact lens wearers because it is very common in them. 93% of cases we see in contact lens wearers. It might be cosmetic or it might be therapeutic or any kind of contact lens wearers. This is because your contact lens can cause micro trauma to the cornea and it is an easy route for an infection to get in. But it is completely preventable and it is in your hands. It is all about maintaining the hygiene. Be it a contact lens wearer or any other person, you should thoroughly wash your hands. And before using your contact lens especially, you have to dry your hands with a lint-free towel. You should always keep your contact lens in your solution. You should never wash your contact lens with tap water. And the contact lenses should be put in their specific boxes. And these contact lens boxes also should be replaced every 3 monthly. If they're damaged before the 3 months, they should be removed and replaced. It is very common for most of the contact lens wearer. They forget to remove the lenses and they go for a swim, they might sit in a hot tub. All this should not be done. You should remove your contact lens before swimming, before using hot tubs. This can also happen when the patients are sleeping with the contact lens overnight. Hello everyone, this is Dr. Akhila Janaki. I am a veterinary retina consultant at Pushpagiri Eye Foundation. They might feel severe pain, redness, watering, and there might be little congestion of your eye, little swelling of your eye. And it also causes photophobia. What is photophobia? You will not be able to see any bright lights. So as soon as you notice the symptoms, the first thing to do is immediately remove your contact lens and consult an ophthalmologist. There are many options in treating Acanthamoeba keratitis. Initially, when you come to us, we give you some anti-amoebic drops like chlorhexidine, PHMB, there are various drugs. But you should remember that treating this Acanthamoeba keratitis will definitely take time because the organism will develop a cyst, a wall around itself. So to break this wall and kill the bacteria, it takes time. So the treatment will be for a longer durations and it is essential that you are in follow-up. Sometimes the symptoms may decrease, but the cyst where the organism is protected can stay dormant and again gets reactivated. So this infection will be a little severe when compared to the other infections. And if we neglect this, there might be scarring of the cornea, there might be decrease in the vision. Once the cornea scars, we have to go for other therapeutic procedures to replace the cornea. And the worst case scenario, if necessary, we have to transplant a new cornea. Maintaining a very hygienic practice of your contact lens is highly essential. That is the key to avoid this infection. And others should also keep in mind that those who do not use contact lens are not completely immune to this infection. Any small corneal trauma, aberrations can also lead to this. So if you experience any pain, foreign body sensation, redness, watering, report immediately to an ophthalmologist.